most awarded in Cleveland. This is News 5 at 11.
Governor DeWine put his signature on the state's biennial budget, and he says it invests in kids, education, job training, infrastructure, and beyond, affecting every single Ohioan's day-to-day lives. But some in our state who are part of the LGBTQ community say it will make their lives harder.
They're worried about a new provision that gives medical providers the right to refuse treatment based on moral or religious beliefs. News 5's Jesse Schultz looked into the impact that could have.
In Governor Mike DeWine's words, the newly signed state budget reflects what is valued here in Ohio. A $74 billion investment focusing on things like infrastructure, schools, and technology.
What this budget speaks to what pulls us together. And it reminds us that we have so much more in common than the things that pull us apart.
Gwen Stembridge with Equality Ohio agrees with the governor. The budget speaks loud and clear.
I saw the billboard that said, Ohio, you can find it here. And I was thinking about discrimination. Now it makes it clear that discrimination in Ohio, you can find it here.
A last-minute provision in the budget allows healthcare workers, hospitals, and health insurance providers the ability to refuse care to someone based on moral, ethical, or religious beliefs or principles.
It should go through the committee process, right? It should go through the process that a bill goes through. Sneaking it in the budget is sneaky, and it's deceitful.
Stembridge worries that small provision in the 2,400-page budget will have huge implications for the tens of thousands of Ohioans in the LGBTQ community.
The fear of going to the doctor and of knowing, are they going to treat me equally? Am I going to get the care that I need? That is already a question, and this just exacerbates that.
People are not going to be discriminated against in regard to medical care.
When asked why he did not veto the provision, Governor DeWine said Ohio's healthcare providers are vast and a patient could find another doctor, and said he respects medical providers' rights to decide who they can treat.
If there's other things that maybe a doctor has a conscious problem with, it gets worked out. Somebody else does those things.
Stembridge said while Northeast Ohio may be home to many healthcare providers, other rural parts of the state are not.
So it's going to prevent people from wanting to go and seek care.
And while Governor DeWine touted the budget as an investment towards a bright future, Stembridge said this provision is a step in the wrong direction.
This will have detrimental effects in Ohio. There is no question about that.
Reporting in Cleveland, Jesse Schultz, News 5.
All right, Jesse, and several LGBTQ advocacy groups, healthcare providers, and the Ohio Hospital and Insurance Associations have spoken out against this new law. Stembridge said Ohio Equality will continue to gather their voices and fight against this provision.
Okay, from broadband to bingo hall.